Hello everyone. Today we are going to deal with the new unit from Medical Surgical Nursing 1, and the topic is nursing management of patients with metabolic and endocrinal disorders. So this is unit 10. So today's topic is hepatic disorders. These are all included in the endocrinal disorders. So here hepatic disorders means disorders related to the liver, that is when liver does not function properly, so whatever disturbance or problems occur in the human body that are considered under the hepatic disorders. So we'll see little introduction of hepatic disorders. The liver is the largest gland in the body. It is situated in the upper part of the abdominal cavity, occupying the greater part of the right hypochondriac region. Liver supports almost every organ in the body and is vital for survival. Because of its strategic location and multidimensional functions, the liver is also prone to many diseases. So, liver is the largest part in the human body, or say largest gland in the human body. It serves the functions. It's almost every function is served. What are the main functions served by the liver? So, if something happens in the liver, that can be easily noticed in the body. So today's topic is cirrhosis of liver or hepatic cirrhosis. That means damage of the liver. So in the introduction of cirrhosis, you can see cirrhosis is a condition in which the liver does not function properly due to long-term damage. Typically, the disease comes on slowly over years. So in this cirrhosis condition, the word cirrhosis means the complete damage of the liver, where the liver is not able to service function, and it happens gradually over year by year when person is not having conscious of its health condition. We'll see the definition. Cirrhosis of liver or hepatic cirrhosis. Cirrhosis is the late stage of scarring, that is fibrosis of the liver, caused by many forms of liver diseases and conditions such as hepatitis and chronic alcoholism. Cirrhosis is a chronic disease characterized by replacement of normal liver tissues with diffuse fibrosis that disrupts the structure and function of the liver. So in this cirrhosis, normally liver get eroded, or you can scarring. Whenever you get any injury, you can see your skin gets removed. So same thing happens in the liver due to the disturbed life pattern or abnormal life pattern. The liver get sclerotic or scarring process happen, that is called fibrosis, and due to which the liver gets start damage. You can see here the differences between the normal liver and how the cirrhosis liver look. Then we'll go for the causes, that means etiology. What are the reasons? The reasons are alcoholic liver disease, non-alcoholic liver disease, chronic hepatitis C and B, hepatotoxic drugs or toxins, cystic fibrosis, primary biliary cirrhosis, primary sclerosing cholangitis, autoimmune hepatitis, Wilson's disease, glycemia, glycogen storage disease type 4. Then other than that, other commonly reasons are cirrhosis is most commonly caused by alcohol, hepatitis B, hepatitis C. Non-alcoholic fatty liver disease, typically more than 2 or 3 drinks per day over a number of years is required for cirrhosis to occur. So mainly the drinkers are more prone to have cirrhosis of disease. Then other than that, other medical conditions also can lead to the cirrhosis of liver. And we'll see types. So there are mainly 4 types. There are alcoholic cirrhosis, post-necrotic cirrhosis, biliary cirrhosis, cardiac cirrhosis. So in that, the first one is alcoholic cirrhosis. So as the name suggests, due to alcohol, when the person is more prone to have alcohol. So in this, ethanol alcohol dehydrogenase, acetaldehyde, then acetaldehyde dehydrogenase acetate, increase intracellular accumulation of triglycerides by increasing fatty and uptake and by reducing fatty acid oxidation and lipoprotein secretion. So when the person takes more number of alcohol, so fatty acid uptake gets reduced in the body. That means they are not able to oxidize. you can take one reason, the person get fatter and fatter. How? When the fats get stored in the body, that means they are not able to use up. Same things happen in this, when this fatty acids are getting into the body and they are not able to oxidize, that means they are not evaporated or not used, so they get stored, and so they are causing cirrhosis of the liver. Then other second one is post necrotic cirrhosis. It is a complication of viral, toxic, or idiopathic. Then broad bands of scar tissue forms within the liver. So like other post necrotic means after any disease condition. So when the person gets chronic illness, so due to that conditions also the person can have cirrhosis of liver. Those include any viral infections or toxic or idiopathic conditions like autoimmune hepatitis and so on. Then third one is biliary cirrhosis. Biliary cirrhosis is associated with chronic biliary obstruction and infection. There is diffuse fibrosis of liver with jaundice as a main feature. So in this biliary cirrhosis, that is main, your liver is not able to respond properly on the bile production, and so this biliary cirrhosis is called. And the main disease condition related to this is jaundice, that means overproduction of the bile content. Then the fourth one is cardiac cirrhosis. It results from long-standing severe right side heart failure, constructive pericarditis, and tricuspid insufficiency. That means cardiac cirrhosis is caused due to the dysfunctions or normal malformations of the heart. Elevated venous pressure transmitted via the inferior vena cava and hepatic veins to the sinusoids of the liver, which become dilated and engorged with blood. The liver becomes enlarged and swollen. So when these abnormalities of the heart increases the pressure of the venous pressure, and when they are transferred to liver, so they get enlarged, the liver get enlarged, and so there is cirrhosis of the liver in the persons. Now we'll see what are the clinical manifestations, signs and symptoms to be observed. So early manifestations are like early symptoms you can notice: anorexia, nausea and vomiting, change in bowel habits like diarrhea and constipation, abdominal pain, fever, slight weight loss, liver and spleen enlargement. Then later management we can see it may be severe and result from liver failure and its complications, jaundice, skin lesions, spider angioma, and pulmonary erythema. So these are the later manifestations when the conditions get severe. Then we'll go for the other symptoms. Other symptoms include thrombocytopenia, leukopenia, anemia, and coagulation disorders. Coagulation problems manifested by epistaxis, easy bruising, gingival bleeding, that is gums bleeding, and heavy menstrual bleeding, endocrine problems. Then in men you can notice gynecomastia, loss of axillary pubic hair, testicular atrophy, impotence with loss of libido. Then young women can have amenorrhea, older women can have vaginal bleeding. So these are the other symptoms you can notice. Then we'll go for the diagnosis of the patient. So in diagnosis, you can go for the lab investigations that include bilirubin, albumin test, prothrombin time test, leukopenia and neutropenia test, coagulation defects, then aspartate aminotransferase, then alanine transaminase, alkaline phosphatase. So these are the tests that will be done to the patient. Then except in that, you can go for the fibroscan, USG, that is ultrasonography, CT scan, MRI and liver biopsy. So these tests will confirm the diagnosis of the patient, whether the patient is having cirrhosis of liver or not. Then we'll move to the management column or treatment section. So in treatment, you will be giving to the patient treatment from alcohol dependency. You will try to withdraw the alcohol from the patient, that is alcohol withdrawal, which will help him to overcome disease slow by slow. Then infections, the patient will be given antibiotics for any infection that arise, since it is caused by viral infections also. So patient is advised to give antibiotics and antibacterial drugs. Then medications to control liver cell damage caused by hepatitis B or C. In this viral drugs will be given. Then a sense taken Blackmore tube with a balloon is inserted to reduce that venous pressure. Then banding, a small band is placed around the base of the varices to control bleeding. If there is more bleeding, the bleeding has to be stopped. Then transjugular intrahepatic post-systemic stent shunt is transplanted in the patient, then liver transplantation is done. This is the overall treatment you can give to the patient. Then we'll move to the medication column. Diuretics are given, increases urine production to get rid of excess salt and water. Then ammonia reducer reduces the amount of ammonia in the body. Then beta blocker slows heart rate and decreases blood pressure. When taken in eye drop form, it reduces eye pressure. Antibiotic stops the growth or kill bacteria. Antiviral drug reduces viruses' ability to replicate. So these are the medications that can be given to the patient. Then we'll go for the nursing management. So nursing management, first and foremost, ineffective breathing pattern related to ascites and restriction of thoracic exertion secondary to ascites, abdominal distension and fluid in the thoracic cavity. Mainly we formulate the nursing diagnosis according to the patient complaint. So at the time the patient, whatever the patient has the top priority condition, that is problem, that will be your topmost nursing management. If the patient complain of pain, so that will be your first nursing diagnosis. If the patient complain of any discomfort, anxiety, that will be your first. So according to the patient's problem, you have to put the numbering on your nursing diagnosis. Then second one is chronic pain and discomfort related to enlarged tender liver and ascites, high risk for injury related to altered clotting mechanisms and altered liver of consciousness. Then fluid volume excess related to ascites and edema formation, disturbed thought process related to deterioration of liver function and increased serum ammonia level, then imbalanced nutrition less than the body requirement related to abdominal distension, discomfort and anorexia, activity intolerance related to fatigue, lethargy and malaise. So these are the some common nursing diagnoses that can be used to formulate for the patient with cirrhosis of liver. Then except in that, you can focus on the patient's problem and you can diagnose on your own. So today's class we have seen about the hepatic disorders, and that the topic was hepatic cirrhosis, that is also known as cirrhosis of liver. So this cirrhosis of liver is mainly the damage of the liver that is caused due to the prolonged lifestyle of the patient or some of the medical conditions. Then you have seen the four types. In four types it was alcohol cirrhosis, post-necrotic cirrhosis, biliary cirrhosis and cardiac cirrhosis. Then you have seen the signs and symptoms that will mainly help you to diagnose the condition. Except in that, the person can go for the diagnostic procedures on the advice of the doctor that will help him to confirm the diagnosis. Then comes the treatment section. In treatment sections, we try to treat the disease with the medication, and though if it is not able to treat properly, then the person go for the surgical management that includes the installation of the stent and liver transplantation. I hope this topic will be useful to you. Thank you to everyone.